Senator Booker, you ready to go?
Roaring ready, sir.
As normal.
Yes, sir. Yes, sir. Thank you so much. I want to thank our witnesses for being here. I have really been in this space working really hard, and I think it is more of a crisis than most Americans can even begin to realize. And one of the challenges is not just making food available, but making sure it's quality, healthy food that's not making our children sick. Right now, obesity rates in our country have been continuing to skyrocket, and it's growing. Right now, about a quarter of our kids of our teenagers are pre-diabetic or have type 2 diabetes. That's stunning, not to mention the obesity rate. You hear it from our national defense saying that right now, very few of our young people are even qualified due to physical challenges with being qualified for a military draft. And much of that can be attributed to the fact that we are seeing this overwhelming amount of ultra-processed foods into our children's diet. They compose right now about 2/3 of our kids' diets are ultra-processed foods, 2/3 of the calories that our children and teens eat. And the ingredients are I say, toxic. They have artificial food dyes in them that have shown evidence of disrupting the body and being linked to hyperactivity and worse. Not to mention the presence of heavy metals and other environmental toxins in our foods, which we know have impacts on children's very brain development. This is a crisis. School meals are one of the key ways, though, we can fight back and make sure that kids are getting the safest, most nutritious meals possible. And that's why I'm introducing today the Safe School Meals Act. This bill would set limits on heavy metals in school meals, reassess dangerous food additives like artificial dyes, ban certain pesticide residues, and ban PFAS in school packaging. And so I think that we have to move with urgency. And the great thing about it, these issues, when you talk about them, have such bipartisan support out there in America. In Washington, we need to get that done. And so I just want to know, even just getting school meals in alignment with the dietary guidelines would be a huge thing. And Dr. Bruning, what effect would doing that have on children's health, just doing that?
The question is, what effect would aligning with the dietary guidelines?
Yes.
I mean, we would expect children to be healthier. 30 million children are touched by school meals, and so we would expect them to...
No, thank you. It's a no-brainer. That was just like, Cory, brilliant. Thank you very much. It is so important. And yet, here we have just some common sense things, though, that also I think steps we should take that have bipartisan support. And that is finding alternatives to dairy. We know that 75% of Black students, 90% of Asian students, 60% of Latino citizens, and 95% of Native American students are lactose intolerant. And meaning that they just are unable to digest this milk without having really detrimental effects. Dairy milk, though, is the only option unless they have a medical waiver. Imagine that, having to get a medical waiver. And so I want to thank the chair, Fetterman, for his leadership, again, on a bipartisan Add Soy Act, which would give students the option to choose nutritionally equivalent plant-based milks that do not make them literally sick. And so I just want to ask again, Dr. Bruning, I don't mean to pick on you. If we gave students that choice to easily select nutritionally equivalent plant-based milk, what effect would that have on the kids' health?
I should disclose that we were recently funded by the National Dairy Council to look at the link of milk and fruit and vegetable consumption. We haven't yet looked at those data yet. Dairy milk does provide 13 important nutrients, and schools can provide lactose-reduced milk for kids who have lactose intolerance. Plant-based milks aren't there quite yet with nutrition, but some are getting there. At the same time, I think we saw with when culturally appropriate milks were introduced in WIC, it was successful. Choice is really important in developing kids' habits and dietary patterns, and some nutrients are better than no nutrients. So ultimately, I think flexibility, as kids participate in the NSLP, and having better diet quality than when they don't. So flexibility and milk choice can help with that.
I love that. Choice, flexibility, and not giving kids the only option for things that make them sick. We are in agreement. You didn't say that I was brilliant, but that's okay. I'll give you one last question, one last chance to compliment the bald people on this dais. We have fragile egos. We need some affirmation. I speak for myself, not for the
So do
senator from Georgia.
academics.
Okay. What would you like to see if Congress was to expand programs like the Fresh Fruit and Vegetable Program, which is an amazing program, which would provide low-income elementary students fresh fruit and vegetable snacks? What impact do you think that would have if Congress did that? What impact would it have on elementary schools and middle schools if they were all eligible to participate?
So in our school salad bar study, we saw impacts in middle and high schools as well. And as I reported in my testimony, we saw increases of fruit and vegetable intake at home for kids who who participated in the FFVP program. So I would expect those impacts to be extended to those additional schools and additional students.
So just, again, common sense. Align with the dairy guidelines, give people options and choice, and then finally, again, expand programs that we already know are working. Thank you very much. Mr. Ranking Member, Senator, thank you very much, sir.
Good job. You only ran 1 minute over. Thank you, Cory.
Thank you.